Don't open your books right now. Can you? Nothing. If you are asked to tell the composition of DLC has been done for, did you join late? Okay, you joined after 1 month. So did you, 1 month means day, on which date? End of November. Did you have you practiced the topic differential leukocyte count at least once or twice? So this was almost going on for 1 month. Okay, still you should know. If you have done 1 or 2 days also, you should know. Do you know? Yes. Methylene blue and acetone. So what should be the full, if you want to tell it correctly, completely, what should be your statement? Methylene blue and eosin, and so you are not answering the question. And when somebody is asked in the exam, remember, when somebody is asked, nobody else should answer. It will carry discredit. You are not answering the question. You are describing what to do. I have not asked you the procedure for differential leukocyte count. I am just asking you the composition of Leishman stain. Okay, what is your take on that? What do you say? Composition of Leishman stain? If you are asked the composition of Leishman stain, you don't answer that. Don't answer anything extra, because in the Viva exam, it is also one technique on part of the students. Just learn that technique. All through your medical career, you will have to appear for numerous Viva exams. In hematology, you are working in the lab, and then the examiner will come and ask you questions. That is one type of Viva, and that is the theoretical Viva. For the theoretical portion, which carries 40 marks, is totally you have to answer. That means you will have nothing to write almost. Sometimes the examiner may ask to do some calculation, or maybe very early draw a diagram, but that is usually not done in the Viva. In the Viva portion, the examiner will ask questions, you will answer orally. So the technique is that never answer something extra. That may be your next question. So you should, the examiner maximum has 5 minutes for you, 5 to 6 minutes for you. So you try to intelligently use that time. If you answer everything in one, the examiner has asked you what is the composition of Leishman stain. You can tell that this stains this, the examiner may be happy also. But if the examiner spends 5 minutes with you, in that 5 minutes, some question may come which is not possible. Everything will not be possible. It is humanly not possible to remember everything and say everything. So something may be missed. So just tell what is asked. Wherever it is very relevant that we should do this, we should tell this also when this is asked, but I should. If the composition is asked, should I tell what should I stain? No, I should wait for the examiner to ask. That is, as the course goes on, you will gain that experience, what to answer. When you are saying eosin and methylene blue, is it necessary to say eosin stains this? No, examiner will ask that. But something which is relevant, you may say, that you have to decide. So in my opinion, don't say. You say eosin and methylene blue, but we should say something more. Leishman stain composition, we should say something more other than this. Anything else? He told acetone. Why is acetone? Why does acetone come in mentioning about Leishman stain? Why is acetone? We are mentioning. He told acetone by mistake. It should be methylene blue and acetone, but acetone is a word which is described in the composition of Leishman stain. You say this eosinated methylene blue in acetone-free methyl alcohol. So now, if this is a complete answer, now you just mention not the functions. You just say eosin and methylene blue, sir or madam. Eosin or methylene blue are the staining components among these. Eosin and methylene blue. Complete answer is eosinated methylene blue in acetone-free methyl alcohol, and the staining components and eosin are methylene blue. Now you will attract questions. If you tell whatever more you say, will attract questions. So whenever you say this, you have to remember why should it be acetone free. Don't never utter what you, if the next question comes, never utter something. Try not to utter something. If a next relevant question comes, you don't know the answer. When you say this, you already know. If you don't know the function of acetone, sorry, not the function, what is the ill effect of acetone, then don't say this. You say eosin and methylene blue. At least you should know that. What does eosin do? Then attract, which question will be attracted? What is the component of eosin? What is the component of methylene blue? But the examiner may say that you have not given me the complete answer, so you have to give that complete answer then. So to say the composition of Leishman stain, you have to, ideally you should make this statement: eosin and methylene blue in acetone-free methyl alcohol. What is the role? Why should it be acetone-free? You should also know. I think you know that by now. But this should be the complete answer, because acetone creates and lyses the cells. Next, here may be procedure of DLC in the DLC. Likewise, what is the composition of, say, what will you say if you are asked the composition of, say, Hems fluid in total count of RBC? The person you joined late, you have done the classes on total count of RBC and WBC. That was after differential count. Total count of RBC, what is the, and also you have done estimation of hemoglobin on Monday. What is the composition of Hems fluid? So whenever you are asked the composition of Hems fluid, say the composition, the names of the substances only: sodium sulfate, sodium chloride and mercury chloride. What is the composition of Turk's fluid? You, next one, next person. What is the composition of Turk's fluid? What is Turk's fluid used for? Which experiment in your syllabus? Total count of leukocytes. Leukocytes. Okay. So you will, what will you do is, you say the names of components and you attract that question. What is the function of, say in the examiner's next question, what do you think is the function of sodium sulfate here? You don't say everything together. Then what will happen? The examiner may ask something, okay, she knows this thing, or maybe you make some mistake, he or she doesn't know this thing, he or she asks a separate question which is you are not able to answer, that will carry discredit. So try to remain within what you know. Obviously, every time it will, at every instance it will not be possible, but try to be intelligent enough while answering. When you are asked about the components, at least this much you should know: eosin, methylene blue. What does eosin stain? What does eosin stain? Next person, what does eosin stain? In Leishman stain, what does eosin stain when we are doing differential leukocyte count, so that we can identify the cells? Eosin stains. So this is a very bad answer. So after 1 month of classes on differential leukocyte count, if you say eosin stains neutrophil, then this is a very bad answer. Next person. Eosin stains nucleus of what? So this is the worst answer possible ever, because RBC has no nucleus. Does eosin stain, anybody, eosin stain the nucleus of any cell? Yes or no? So you may face MCQs also. Sometimes some examiners prefer to set some MCQs from the whatever is in the syllabus practical. That means they are actually, I would say they are nice examiners. They set MCQs from whatever, obviously whatever you are doing with your own hands, it is more easy to remember, or though related to those topics. Whatever you are trying to memorize in theory classes, by theory topics, it is difficult to remember if it is a thing of memorizing. So, and whatever you do with your own hands, it is easier to remember that thing and the relevant things. So you may face an MCQ also. What is the eosin is staining eosinophil? What part of eosinophil? So my question is, eosinophil, does eosinophil stain the nucleus of any cell, or yes or no? Cytoplasm, nucleus is also wrong, cytoplasm is also wrong. Eosinophil stains eosinophils. What of eosinophils? So in general, today there are only few students, 3, 4, 7, 9, 11, 13, 16 students out of 50. So see, out of 16, barely anybody could answer, barely. Maybe only she answered correctly what she told, but that was not complete. Whatever is being asked, you have done DLC for 1 month. It has been told many times that eosin, just remember eosin stains. What does eosin stain? Which part of eosinophil? Granulocyte. Granulocytes is eosinophil itself is a granulocyte. Granulocytes contain granules. Eosin stains granules of eosinophils and the cytoplasm of RBCs. You may say cytoplasm, actually cytoplasm, eosinophil cytoplasm, the fluid, what is the cytoplasm properly, the water or fluid part, that is not too visible because there are coarse granules. Cytoplasm is a very partially correct answer. You should say granules of eosinophils, and RBCs will not contain granules, neither nucleus, and obviously not, but just know that by Leishman staining we will not be able to visualize the cell organelles like as such. So by methylene blue will stain everything else, whatever comes to your mind, while nucleus of neutrophil, eosinophil, basophil, monocyte and lymphocyte, nucleus of these things. Now nucleus in neutrophil, eosinophil, basophil are lobed, nucleus is lymphocyte and monocyte are not lobed. Monocyte has a kidney shaped nucleus lying towards the periphery with some abundant or at least some amount of cytoplasm to the other side. Lymphocyte is almost totally rounded nucleus with a thin rim of cytoplasm around the periphery. This is what is the how to identify cells. So at least you should know what stains what. So this is very basic. So eosinated methylene blue in acetone-free methyl alcohol, and what are the functions of eosin and methylene blue are the staining components. This much you say and wait for the next question. Next question may be why is it acetone-free? Next question may be eosin stains what? Next question may be methylene blue stains what? So don't try to memorize what methylene blue stains. Whatever comes to your mind except granules of eosinophils and RBCs is stained by methylene blue. Nucleus of neutrophil, so the lobes, they will be that bluish deep purple color. Okay, basophils nucleus is more bluish, more stained. The staining characteristic is more. So basophil is most bluish stained. Neutrophil is, that's why the name neutrophil. It is like intermediate. And among basophil, neutrophil and eosinophil. Eosinophil nucleus, this staining bluish appearance is not that much as basophil, but basophils are very rare, difficult to view. So you may not get maybe not one single basophil also in counting 100 cells. So I thought I'll just in 10-15 minutes I'll revise all the topics which you have done and then we'll proceed. But see, you are already stuck in one topic which has been done for 1 month. Nobody is being able to provide correct that which answer will be very suitable for during the exam. Examiner will be very happy. So today proceed and practice differential leukocyte count again.